Yes. Hi, good morning, everyone. So, today's session will be really helpful and it's led by Dr. Rima from Apollo Cradle and Children's Hospital. She's going to talk about high BP and gestational diabetes during pregnancy. So, I think stick around until the end. Ask your questions if you have any in the comment section, and I'll not keep you all wait any longer. Doctor, you have the stage. I will exit. Thank you.
Yeah, good morning, everyone. Thank you for joining today with me. Today, I will be speaking about very important topic. These are very important and common difficulties which we are facing. These are the complications which are very common during pregnancy. It is high blood pressure and diabetes in pregnancy. So, if we see the incidence, the prevalence of the problem, then world over it is around 15% of all the pregnancies, the high BP and high blood sugars are detected. In India, it is somewhere around 7%. Like 1 in 12 to 1 in 14 women have high problem of high BP during pregnancy. So when do this is the BP issue can be classified into two things, like one is the patient is already hypertensive and then she becomes pregnant. This is called essential hypertension, and she can continue taking the medicines. The other, which is very important, is pregnancy induced hypertension. Like first time the high blood pressure is detected in pregnancy. So by definition, it is like when the doctor sees the high BP readings during pregnancy after 20 weeks, not before 20 weeks. If it is before 20 weeks, then it is essential hypertension, like the patient must be having BP previously, which she is not aware of. But if the BP recordings were normal, and then after 20 weeks, like in 6 month, we start getting high BP recordings, then it is labeled as pregnancy induced hypertension, PIH, preeclampsia, whatever we say. So what is? Let's see what is the cutoff for that BP. So anything above 140 by 90, if the BP is recorded 140 by 90 more than 2 to 3 times during pregnancy, then it is labeled as pregnancy induced hypertension or preeclampsia. So, because of the high BP, there it is both. It can cause health issues to both the mother and the child. So let's see what can be there. So first, you all whenever you get pregnant, every time you go to the doctor's clinic, we check your BP, weight, and everything. So why is it so important? Because we have to check it every time. And if we record a BP of around 120, 120, 90, 130, 90 home and inform if the BP recordings are 140 by 90 or more than that. High BP can be detrimental to the health of both baby and mother. So, in case of what are the effects of high BP on mother? All of us know that the high BP, what is the basic cause? The cause of high BP during pregnancy can be due to some maladjustment of the placenta and the mother. So it is a very complex situation. You don't need to go into the detail. But what are the effects? Repeated headaches, high BP, then swelling in on face, hands, feet can be there. Decreased urine output at BP can cause derangement of liver functions and kidney function. It causes extra burden on the heart. So all these can lead to effect on mother's health adversely and about baby. If it is high BP, if high BP is there in the first 3 months, then there is a high risk of miscarriages, in the sense that the blood supply to the baby decreases, because what is happening in high BP, the vessels the carrying the blood, which are arteries, they get constricted, they become narrow. So when they are narrowed down, the blood flow to the uterus decreases, the blood flow to the baby decreases. So in the first trimester, we get the challenge of missed abortion. Like baby, the pregnancy is growing, try to grow, but the blood supply is not adequate. It can lead to missed abortions, like heartbeat band ho jati hai. So these are the things. Then in second trimester again, baby is receiving the less amount of blood, so the growth will lag. It will start lagging. Then the development of the baby starts decreasing. The amniotic fluid is very important marker in this, because of the low amount of blood reaching to the uterus, the amniotic fluid levels can also decrease. Overall, in high BP cases, if it is not controlled on time, then it can lead to small babies, IUGR, we say intrauterine growth restriction of the baby. So the growth is hampered, the amniotic fluids become low, maternal health is compromised, and all this can have effect on the baby, ultimately ending up into a poor outcome. But the good thing is this can be timely detected and treated. So what we can do, how to detect, whenever you check for your pregnancy, get pregnant, go to the doctor, they will do the workup. Or every visit, BP is recorded, weight gain is recorded. BP is important, as I told you, the levels I told you. Anything 120 by 80, up from 90 to 60 to 120 by 80 is normal, plus minus 10 is acceptable, 130 by 80, 140 by 80, it is acceptable. If it is more than that, then do BP charting at home. So, how to check BP at home? You can either go to a nearby clinic and get it tested at different times of the day for 3 4 days. If the BP readings are more than 140 by 90 at three different instances, then we label it as high BP. And what precautions can we take if we are suspecting high BP? So the precaution is firstly is diet. In diet, avoid high sodium content like excessive salt intake, spicy foods, मसालेदार खाने, नमक ही नमक खा रहे हैं, नमक को कम करना होता है. Then then take a lot of green leafy vegetables, carrot, spinach, capsicum, avocado, and all are not there in India, much taken in diet. And you should eat your meals small and frequent meals. एक बहुत सारा नहीं, कम खाएं, healthy diet ले, easily digestible food, low in sodium content. Then exercise is also very important. People think exercise से BP बढ़ेगा, but 20 to 30 minutes of moderate exercise like walking is the simplest thing, and pranayams, breathing in, taking deep breaths, these will help. Then medicine, initially if we suspect that the patient might go into high BP later on in the pregnancy, then usually we start with low dose aspirin. Low dose aspirin is the first drug which we can start in the first trimester also when the BP is not yet high. So what it does, it relaxes the blood vessels, so the blood flow to the it makes the blood thin, so the blood keeps on flowing from mother to the child. Then the next thing we come is to more important problem in pregnancy is diabetes. Recently, it has been seen that diabetes has become very common, especially during pregnancy. So, in pregnancy, we do the blood sugars at the first visit. Then we go for the glucose challenge test and glucose tolerance test in the second trimester. In high risk cases, like those who are overweight, those who are diabetic,